Welcome back. Now, the National and County Government Coordinating Summit that is chaired by the President will soon be compelled to establish at least 8 regional cancer centres should proposals in the Health Amendment Bill 2021 be passed by Parliament. Bumula lawmaker Mwambu Mabonga says the centre will help Kenyans test and detect cancer early for treatment. The bill also seeks to outlaw retention of bodies at the hospital over pending bills. Our reporter, Patrick Amimo, has more.
In Kenya, cancer is the 3rd leading cause of death after infectious and cardiovascular diseases. The 5 most common cancers in Kenya are breast, cervical, prostate, esophagus and colorectal. Cervical cancer is the leading cause of cancer deaths. According to the Global Cancer Observatory report of March 2021, Kenya recorded 42,116 new cases in 2020. Out of these, 15,556 were male, while 26,550 were female. A total of 27,092 cancer deaths were reported last year. Out of these, 10,466 were male, while 16,626 were female. Bumula lawmaker Mwambu Mabonga is seeking to amend the Health Act to compel the national and county governments establish regional cancer centers.
If we can have those cancer centers in our regions where the government can invest in, most of the patients will discover their problems early enough, and definitely they will be assisted.
In a bid to enforce Article 43 of the Constitution, the bill makes it an offense for a person in charge of a public health facility to demand payment of advance medical fees as a precondition to provision of medical services. A person guilty of the offence on conviction will be liable to a fine not exceeding 3 million shillings or to a prison term of 3 months or both.
We've been in some places where you can find patients dying in public parking. So it's not that we are trying to criminalize, but we are trying just to make people a bit responsible.
The bill also proposes to make it an offence for a person in charge of a public health facility to detain the body of a deceased person as a means of enforcing outstanding medical bills. A person guilty of the offence shall on conviction pay a fine of 2 million shillings or to a prison term of 3 months or both.
There could be a way you enter into a contract with the members of the family, and then you release the body, because as you retain the body, more charges are being added on, and the person may be responsible to pay that is that person you are retaining and is dead. That person will not even be converted into a plot or a vehicle and then be sold to settle your bills.
The bill has been committed to the Committee of Health for public participation. Patrick Amimo, KTN News.
And still in health news, Cabinet Secretary Mutahi